All right, let's talk about the 3 contraindications to somebody being on certain peptide therapies. And this would be for people who want to start potentially on BPC-157, TB500, growth hormone secretagogues, or GLP-1. Okay, so one thing that's very important that your provider should be asking you is if you have a personal history of malignancy or a personal history of cancer. If you do have a personal history of cancer, this is something that is absolutely contraindicated. I would not prescribe it in my practice, and any provider who has a reasonable amount of due diligence would agree and recommend otherwise. So that's one thing that's very important. Second most important thing would be to check and make sure somebody doesn't have a strong family history of malignancy. For example, medullary thyroid cancer is something that is an absolute contraindication if a patient has family history of medullary thyroid cancer to not be on a GLP-1. So anyone giving you or providing you with a GLP-1 that's not asking you that is really doing you a disservice, because it could be something very, very unsafe. And that's one way of knowing or telling if the source you're getting your peptides from is a clean or reputable source, is if people are asking you these questions, because these are things that could really adversely affect your health in the long run. The third most important thing somebody should ask you is if you're up to date on your cancer screening, right? If somebody's due for their colonoscopy or due for their mammogram and they haven't had it done, that's something I would want my patient to have done before starting them on peptide therapy. I want to make sure that their cancer screening is up to date and negative. For example, if somebody did have cancer screening that I reviewed and they had high risk atypical dysplastic features, such as somebody with polyps with high risk features, then you potentially wouldn't want to put them on peptides, but you at least need to have physician-patient discussion and conversation to talk about the risks and benefits. Patient needs to know that if they have an active malignancy, there is an increased chance of it growing faster or spreading with certain peptides that have things like VEGF, which are growth factors that proliferate angiogenesis, cause more blood vessels to form. This helps with inflammation, it helps with healing of certain injuries, but it also can promote certain malignancies. So this is why the physician-patient relationship is so important. This is why it's so important to do risk-benefit analysis with the patient. We call that informed consent. We discuss these things with the patient and we come up with the best treatment plan that would be safest and best for the patient. If your doctor or the person, whoever you're getting these peptides from, keep in mind some of these research peptides, you don't need a prescription. You can just get them online or over the counter through the gray market. If you are doing that, please speak to your doctor at least about starting these peptides, because they can at least check on these important things. Make sure you don't have constitutional symptoms like B symptoms, fevers, night sweats, unintentional weight loss, lymphadenopathy, things that are concerning that one might argue against peptide use. The minimum you can do is do the due diligence to ask your physician if it's a good fit for you. If you're going to be getting it through a research method, at least talk to your doctor about it, and make sure if you are getting it from a healthcare provider, they're asking you these questions. If they're not, that's a red flag. You probably need to find somebody who is going to be a better advocate for your health, and not just right now and the way you feel right now, but your long-term health, which could be affected by these peptides if they're not done accurately or in the right way.